So tell me what makes it about your brows. I mean, when I see you, that's what I see. But tell me what you see. Like, what is that?
Well, I just think I look tired, and
Did
somebody
people ask you?
Well, yeah, huh?
Only women though, right? We were talking about this earlier.
Right. But I mean, your eyes change your look tremendously. I think they're the main thing. So if your eyes look good and not droopy, it changes everything.
It does.
I think.
Makeup
Eyes are my
helps
favorite
too.
procedure in plastic surgery.
Really? We've done a lot of eyes together, Philip. What's your
I
favorite thing
know
about it?
it's eyes, just because, like she said, if your eyes look more awake and you look brighter, people think you feel better, and you automatically feel better because you look better.
Yeah.
So
And we do a lot. We do them. I like a very natural eye, and we see people that have an overly aggressive look, and we don't do them like that.
yeah, you don't want to look like you just went to Fright Night.
What'd you say that one time to that? Somebody?
You don't want to look like your mommy pulled your pigtails too tight.
You really don't. So on the Chrisleys, he was going to get Botox, and they were all kind of making fun of him. Have you seen this one? The birthday one? Have you seen it? Where they start whispering, and he's like, stop it! But anyway, he goes to get Botox, and he's expecting that guy to say, no, you don't need anything. And instead he's like, yeah, this is what you need. And he screams with the Botox. It's like, it really doesn't hurt that bad.
So how is this feeling to you right now? Does it feel really warm? Is it uncomfortable? Or would you say this
It's
is
not
easy?
uncomfortable. Right now, it's pretty warm, but it's not uncomfortable. Like if, you can't stay in one spot for a long time, right?
Right.
I assume.
The beauty of this over Thermage and everything else is this company really has the temperature management down. So the machine's not going to get hot enough to hurt you, and it's going to, with you being awake, you're going to tell me. That's why we don't numb it. And I can look at it and I can set what I want it to be versus what, and I can see what it is. So we're going to, then there's a little bit of art to it. There are places where you can go a little more, but it's basically about the time that you spend with this one, on the tissue. I notice when I need to do it when I start getting eye makeup on my lashes or mascara up higher. And for us, for women, we've always worn makeup because it made us look better. And you start wearing it and you look worse, or you rubs in funny places, and you're like, now I really feel bad. My poor mother kept going for lip lines, and they kept giving her different lip pencils. And I was like, if you're going to wear that hot pink lipstick, we're going to have to add a little volume. She's like, no, it's the liner. I said, no. Who told you that?
So how long will it take for her to see results?
We will see it in just a minute. We'll show you one side, because a lot of people have asked. And when I was doing that, doing mine, I didn't stop, and I guess I can tell. I didn't think about it. But with her, like, I can show her, and you'll see the difference in the two sides.
And how far apart should you repeat the sessions?
Within 6 weeks. So you could do them 2 weeks apart. You could do it, further apart. But you only once you do 4, then you get, the results are up to 2 years. Now, honestly, you continue to age, but I've never seen people as happy, other than like Halo is another one. This makes people really happy, and it's because there's no downtime. So, it doesn't work if you really need a facelift. I can't tighten it enough to where you don't, but you can certainly tell. Like, it's one of those things you won't feel like you have to ask other people, can you tell?
So how soon can she apply makeup?
Immediately.
Okay.
Now, we used to use Excelus, and I got burned with it. But because the temperature regulation wasn't as good, and the results were never as good. And so this one is, they have radio frequency down. They really do. It's just their thing. And radio frequency is great. So what it's doing over time is stimulating your body to make collagen.
So whatever her morning and nighttime ritual is for getting ready for bed, she can use all of her same products that she's currently using.
And what are you doing?
I just wash my face and
Are you using any eye creams or anything?
sometimes I do. But I use this gel moisturizer and I put it on my eyes too. And sometimes I'll use like a heavier cream. But I don't know, it doesn't seem to make a big difference.
It's frustrating when you keep trying stuff and you think it's going to work.
Yeah.
Would Revox
Revox is
enhance
good.
this?
Actually, it would. Revox is nobody really knows how, well, I'm sure revisions, they watch this, they'll say they know, but like it's kind of like liquid Botox, but it helps with all these little lines. And if you put it on, within a few minutes, you can tell which sides you have it on.
Oh, wait. I have something like that.
Have you tried it?
Mm-hmm.
It's in a black bottle.
Yeah.
Okay, that's good.
Maybe I have it.
But there's not anything that's going to do as good as this. Okay, so we've got that.
I'm a little
side.
lazy when it comes to makeup and stuff.
Well, but when it's good, you want to do it.
Mm-hmm.
Like if you can tell a difference, then it's something that you want to do. But when you use something and you can't really tell, you get frustrated. At least I do. I like for things to do what they say they're going to do. So what do you think, Philip?
I do. I can definitely tell that upper.
And that's our lower one.
Mm-hmm.
They look very even. Come look from up here. Can you see? We have one side that's lower, which is why I was telling her she may not be the best person to show it, but because one's lower, but this is almost exactly even with this. I don't know what y'all saw starting out, but so it doesn't take much time. Tell me about how painful did you feel like it was?
I mean, I don't feel like it's painful at all.
Okay. Just feels warm.
Yeah, just warm.
It has a smoothing effect too that's instant. So when I finish, you'll be able to look at it and you'll feel like it's smoother. We'll add a little bit of, sometimes we do Botox with it, because that helps too. But this is just, it's got a lifting effect and it's got a smoothing. It kind of smooths. The only thing around the eye, it'll help with this, that little bit of extra skin too. And you can use this in the folds, like the smile lines. You can use it on the neck. It doesn't work when there's a whole lot. The forehead's really good because there's not a whole lot of tissue, but we can use it here.
Now, under the eyes, does it help with that little shelf area there?
Yeah, it helps it smooths it really well. The only other thing to do for that, for the brows, is surgical. And it, you want to do your lower lids once because they're sensitive. So you'd rather do those with your mini lift because you're going to have to do it again. You okay?
Mm-hmm.
These little vessels, you do have some little vessels on your cheek. We can treat those with BBL or broadband light. They're just from sun damage and they tend to come back in the summer and then go away again. This helps with, it just smooths everything out. So she can go do whatever she wants to do. She can put makeup on and hide the redness. And you're not in any pain?
Right here in one spot, it gets hot.
Okay.
But other than that, right in the corner.
So people really won't let you, if anybody's thinking that, people won't let you hurt them. So that's why there's no numbing or anything with this. Everybody has a spot, and a lot of it's just doing a lot of it and knowing how to move it around. Well, Philip, men are actually having this in their scrotums now. It's called scrotox.
What?
We'll stick to your brows, but
Yeah, let's stick to the brows.
that's an Atlanta thing. But they are. That's another. It'll basically tighten anything. There's Thermiva, which is the vaginal tightener, which has a totally different disposable handpiece.
It's not the same one.
That's good to know.
It is good that it's not used, but it works really. A lot of people are really embarrassed and have trouble with that, and it really works, and it makes things better.
So, does it make it better for the women? Is that what you're saying?
Yeah, it makes it to where I'm gonna turn this off and get this out of your eye. It makes it better for women. Makes sex better. It makes it where you can go longer without going to the bathroom because it tightens the part of the bladder. But women love it. They say men love it in all the surveys, but I don't know how picky men are. Oh.
So back to the scrotox.
Forgot about the
Why
lab.
would you do that to the scrotum?
Because you don't want to. I mean, I don't do it. It was in
Okay.
an article I just read this week. Because they call it Brotox, which sounds ridiculous for Botox, and now they're saying
Oh gosh.
Scrotox is next. Well, if you don't,
Oh, thank you.
yeah, we just got you into your eyes. But it just to tighten it. It's just that just telling you that's thin skin. I mean, it's not going to hurt anything.
So basically, this works for the thin skin areas like the face.
Mm-hmm. It's great on the face. I love it on the brows because this is real thin skin. It's this thin, one of the thinnest skins in the body. So it does tend to give you a much more immediate reaction.
Where else can you use this on the face?
We use it on the folds. We use it around the lip, mid-face, kind of cheeks.
What about the jowl area?
Early jowls.
Okay.
There are people that just, for the most part, jowls on this part need a mini lift when you get right here. Because people put filler and it looks ridiculous. You don't want to have square face. So, there's not much you can do for that area other than surgery. If it's real slight, you can use this with thin skin and you can get some lift. As long as, to me, people just need to know, here's what you can expect, here's what you can get from it. Just so they don't have something and then feel disappointed. Surgery's the end-all be-all for gels, but the other thing I've noticed, which I saw some pictures today, which she wants us to use her pictures, so I'll have to show y'all later, but cool sculpting, when you do this side, it helps this part of the face. You okay?
Yeah, I was gonna say move your thing.
Okay.
So are you saying
So
right
we're
here?
almost done.
Under
We have
the
like
chin?
30 seconds left on this side, huh?
Under
Yes.
the chin?
Like you can tell right there, like you
Okay.
crisscross that cool mini. And the biggest place I could tell with her, and she's not even 3 months, was on the side. You got this?
So Thermi eyes typically takes about how long to do?
10 minutes.
10 minutes.
I've done a little bit more on her. This side the second side heats up faster, so you basically want it to get to the temperature where you want it and have it stay there for about 5 minutes. And the
Okay.
eye's easy to heat.
If you wanted to do cool sculpting under the chin, how long would that take?
That takes 45 minutes a cycle. We usually do 2 cycles. So you can do Cabello when you just want to get right under the chin, but when you want to get this, you've got it. The cool sculpting works really well. Okay, you're good. Now let's wipe it off and let you see, and you can give people your honest thoughts. Prettiest mirrors
So?
to have.
Oh.
Here
I'll
go.
let you fix your hair while I focus on the wall.
There's a big difference. I can really tell from that. Just from that mirror.
Yeah, look at the
There's
corners
a
of
big
your brows.
difference.
How
Yeah.
much higher they are.
Oh yeah, I think there's a big difference. I'm surprised. Are you?
No,
No.
I
I'm like,
Well,
but
see,
there is
you
a big
look
difference,
so young
right?
here, and you really do have the prettiest eyes. Yes, because they look much more symmetrical. I did them different because this one's lower, and this one's still a little bit lower. So we're going to put a little bit of Botox right there. Smile. Can you smile real big so they can see how they come down? That's not real. You got tell her a
Okay,
joke.
wait.
She has to do a real smile. There it
That's
goes.
real.
It pulls down more right there, so we can do a little bit of Botox, and that helps let that come up. But it makes your eyes look more open.
Yeah, it
And
looks.
it's gonna, over
Yeah,
the
I
next-
can tell. It looks
even over
better.
the next few days, it's going to get stronger.
Great job.